Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer, the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody.
Yeah, a little fluffy white. It's not so fluffy, heavy white stuff this morning.
A little unexpected when I woke up last night, driving between East and West Lake, and the ice completely out. It's beautiful, but it's going to melt today, I think.
Yeah, it is. All right. An impressive, cool guest at Okoboji Wellness Clinic this week or recently.
It's really, it's a fun to be on the journey. I always speak of how grateful I am to connect with others and learn from others, lean into other relationships. And over the course of the last 4 to 5 years, the COVID epidemic and experience have touched a lot of lives, both patients and doctors. And many of the doctors, this one included, is he's in California, but he does his traditional job as a traditional physician, and then he is getting into the mixture, like us, this holistic blend between traditional and alternative. And same story for him. And we met at conferences, and these conferences are things that are opportunities for medical education to learn in areas that are things that weren't necessarily all taught to us in medical schools. For instance, we learn about ways to look at hormones a little bit differently, or way to look at the thyroid a little bit differently, or look at toxins in the environment, looking at our whole body, the digestion and the brain and the gut microbiome. And so these are opportunities to collaborate, and it was just a blessing to have him out for a couple days, and he was very kind and stated, wow, you guys have something rolling really special right there, and I want to replicate that out in California. And so it is fun to share those ideas. He does ozone therapy like us, and is involved in a lot of different other areas just like us, and we're able to see how he does things, and we show him how we do things. And I think that's what when medicine is really humming, from a whole journey wellness perspective, it's when things like that, the opportunities are there for collaboration, for folks to talk about the tools beyond the tools that they were taught in school. And so that's what it was the last couple of days, and it was inspiring for the team. And we even did a hip joint injection with prolozone, which went really well. And so again, just grateful. Just like to share those little tidbits of who's coming along into our clinic. A lot of times we get guests from out of state, and we have them talk at Wellness Wednesdays. But the territory that we're in right now, it's a fun space to be in, where there's an excitement. And as we were talking with this individual, and I hope to have him on sometime as a guest, but on a Wednesday morning. But as we were talking, some of the things that we have seen, he has seen out in California in his practice, what we've seen here, still get the old jaw drop is still, and that's what makes this practice of integrative wellness so much fun, because we're seeing things that where folks that have been spinning their wheels and struggling for a long time, making huge strides for their wellness journey.
6 years ago, the journey began, where people peeled back the curtain, so to speak, and many people and many traditional medical professionals were like, wow.
Wow is right. And we're still saying wow every day. In that group of doctors and practitioners, nurse practitioners, is growing by the day.
Yeah.
And so it's sweeping across this country.
Let's talk a little bit about the thyroid. Matter of fact, let's just talk about the thyroid and just lab testing, because sometimes you get a test and it says everything looks A-okay, but you do a little deeper dive and maybe everything's not as perfect as that lab result might state.
So I wanted to share a win, because I know this applies to some folks out there, that they say, I just know my thyroid is low, and I've got cold hands and cold feet, and a good percentage of the thyroid, the energy used from the thyroid, is used to produce heat. And what happens as we get older, it tends to be that we don't maintain our heat as well, and we say we're cold. And that is one of the telltale signs that the thyroid's not up to snuff and that it needs support. And many times we'll get blood testing, and the question is how close to accurate or really specific is the blood testing. And many times it can give us ballpark, but like any kind of testing, you have to use that along with the whole big picture. So there is the clinical signs, which may be constipation, maybe low energy, brain fog. I'm struggling losing weight. The outside of my eyebrows are thinning, hair loss. Yet I go in, and my blood work is the thyroid labs are apparently in this normal range. And there is a great debate over what that normal range is that's been going on for some time. And there are some providers and physicians out there that will look to address it more aggressively in combination with the whole clinical picture. Again, the exam of the individual, of the patient, the history, all that blood work, and then also we throw in the metabolic testing. And that's been the absolute game changer for us, is when we throw in the metabolic testing, which it's a test, about a 10-minute test that's measuring your oxygen, CO2 exchange, that is going to give us a great indicator of what is the health of that thyroid gland. So in many cases, if the labs are they're not perfect, maybe they're a little close to being out of range, they've got some symptoms that go along with it, their physical exam is suggestive of it, and then we do this metabolic test here in the clinic, and that also is looking in the direction and confirming that, oh, wow. And the interesting thing, Dave, is this is what they were using years ago. It was basal body temperature, measuring the temperature, also metabolic testing. And it used to be a very complex way. It was a lot of math in a big device. Now the device we use is about the size of a shoebox. And there's an algorithm that calculates it for us, and we're able to get that thyroid score really one way of, as a measure of thyroid health, through that metabolic test, quite easy now again. But back in the day, they end up finding, oh, we can test the thyroid through blood work. So they switched from the metabolic testing, went to the blood testing. They never really corroborated how much of a direct relation was there for the thyroid and the metabolic. Are they a one-for-one comparison, meaning how accurate is the blood work? Now, when you have this metabolic testing, we can add that to the equation, and we can be a little bit more smart and specific with the thyroid. So the thyroid, it sits below the Adam's apple, and like oxygen, you got to have it. You got to have it to survive. And so when we are looking at that thyroid, we're looking at what is causing it to not work well. And it can be exposure to heavy metals. It can be viruses. It could be an autoimmune condition. Believe it or not, even gluten in some cases can affect that thyroid. And so we do the testing. We measure antibodies on it, which is a blood test as well. And one particular case that I just thought was so fun that I would have missed 5 to 6 years ago, Dave, was a gal that came in this week, and she said, my life has changed. My life has turned around. I didn't know I could feel this good. And it's a pretty interesting thing when we look at that thyroid replacement. There is something called levothyroxine, which is a synthetic form of thyroid called T4. And this is what this individual had been on for quite some time at the same dose. Some folks have a deiodinase deficiency, which is an enzyme that converts the T4 to T3. The T3 is the active form of thyroid. So if that's not functioning in well, and to function well, you need things like adequate levels of iodine, zinc, selenium, B vitamins. And so there's a lot of minerals, cofactors, vitamins that are out there that help that thyroid work better, and most of us are low in them. So one of the ways to work on that thyroid is to really support it through these minerals and cofactors and see if we can get it working again. In this individual's case, we made a switch from a synthetic form to more of a natural prescription form of thyroid, and that had the T3 in it, that individual didn't have to convert it to T4 to T3. And literally within a matter of 3 days, that was the response I had. They came into the clinic and said, oh my gosh, I really don't have anything more to say that I couldn't feel better about. I feel amazing. This is the best I've felt in years. And it was the one simple approach, just working on, of course, we worked on some other things with anti-inflammatory approach with the nutrition plan and eating whole foods based and not having processed foods, the value of movement. But wow, making sure her digestion's flowing, but just that focus in that little piece of, was there enough T3, which is the active form of thyroid, for that individual to feel good? And apparently not, because when we change that, so I think there's a lot of folks out there that probably have been told their thyroid's normal, and I think there's a greater percentage of folks with an inactive thyroid, a low active thyroid across this state, across this country, that certainly should be addressing that discussion with their provider, because that is one of your key master metabolism hormones, the thyroid, T3, T4, and in some cases, depending on what we give you, sometimes we'll have a little T1 and T2 in there too. But how fun! When 7 years ago, I used to have some of my patients come up to me, Dave, and be like, I read about checking for free T3. I read about checking antibodies. I'm like, no, we just check a free T4 and a TSH, and that's all I pretty much did. And then I started to dig a little bit, thanks to my patients in the past and in this journey over the last 5 to 6 years, identifying, maybe there's more to the story about this thyroid that I could be diving into to help my patients a little bit more.
Yeah. It's pretty incredible. It's amazing. You talk about it all the time, peeling back the layers of the onion. Man, I'll tell you what, there's a lot of layers to this onion, and there's been some remarkable discoveries over the last 5-6 years, that's for sure. Hey, we're out of time. We got to go. But if folks want to visit with you, want to feel better, want to thrive, not just survive, how can they get a hold of you?
Call us at 712-339-6024. Molly Avery, Mychal Sheridan, myself, we all do discovery calls. Those are complimentary. I give you a little taste of what a visit with us might look like. Or, of course, you can just call that number and set up an hour-long visit and get you going that way. We do... we're just off Highway 71 in Spirit Lake at 3305 Berquist Avenue. And we look forward to seeing you and starting your journey and getting you as we say, thriving, not just surviving, Dave.
Yeah, we've got a lot to talk about, a lot to cover, and we'll do that in the coming weeks. I want to talk about, we've talked about hyperbarics. We can talk about that more and more. I just saw a remarkable hope story about red light therapy, which you do. You talk about ozone therapy. We haven't talked about oxygen treatment through a nebulizer, which is astonishing. And
it is astonishing.
And we got to talk about that as well. So we've got lots to cover.
We've got lots of topics, and we got plenty of time, so we'll keep going.
All right, very good. Dr. Meyer, have a great day. We'll chat again soon.
Thanks, Dave. Be well, everyone.
Thank you. Dr. Bradley Meyer at the Okoboji Wellness Clinic. And you can find out more at OkobojiWellnessClinic.com, where they really do want you to thrive, not just survive.